A vascular occlusion is one of the most feared complications in aesthetic medicine, and we always talk about how to treat it, but we never really talk about the stages of ischemia your patient will go through if, God forbid, they were to experience an untreated vascular occlusion. So today we're going to go through the 5 clinical stages of skin ischemia as originally described by Gillian Murray, a clinical researcher based out of London, and further referenced by Dr. Danny Soares in his most recent publications. So we're going to use a real-life case and show you step by step what these 5 clinical stages of skin ischemia are. But before we begin, I really want to take a moment to say thank you to this person for allowing me to use their photos. This is how we grow as an industry, and this person wanted to pour back into the industry so that injectors are more ready and can learn and grow from this experience. We can recognize, treat, and better manage these complications. So thank you for allowing me to use your photos. So without further ado, let's get into these 5 stages. This is stage 1, pallor with delayed capillary refill. You could see when she pushes down on that tissue, she has a delayed cap refill of greater than 2 seconds, and she's experiencing this blanching appearance. This is due to that blockage in the artery. Now this, as referenced by Dr. Danny Soares, is the most crucial time and probably the only reversible moment in the entire journey, where early intervention with high-dose pulse hyaluronidase is so important and can truly prevent the progression entirely if we can clear it in this exact moment in stage 1. We'll then progress into stage 2, which is called Livedo Reticularis. Here, venous congestion from the ongoing occlusion allows for deoxygenated blood to pool into that dermal plexus. Now, Gillian believes that this can happen from about 24 hours to 36 hours. And what you'll see is that you'll have a purplish lace-like mottling appearance, and it kind of maps out the entire affected angiosome. As we continue on in the stages, we'll progress into stage 3 right about day 3. And this is called Bioburden, or as Gillian puts it, barrier failure. What happens here is due to the prolonged hypoxic environment, we disrupt that normal skin barrier, which then causes a bacterial overgrowth. So what your patient will experience, as you could see here, is pustules. It'll look like weepy skin. The skin will be really moist, and it can almost start to peel off at this time. Dr. Soares references that this is no longer just an occlusion problem, but it is now a true skin injury problem. And activating your wound care protocol is important, whether it's dressing changes, gentle cleansing, and plus or minus antibiotics depending on what that wound is looking like. At about days 5 to 10, they'll then progress into stage 4, which is called coagulative necrosis. And this is where the cells have died, but the tissue structure still remains intact. What you'll see here is something called sloughing, or a yellow wet necrosis. At this point, there's not very much pain, and we're truly just focused on wound management and really protecting that surrounding viable tissue. So truly the focus of this stage is wound management. Now we progress into the final stage, which is stage 5, and this can happen anywhere from 1 to 2 weeks depending on the wound. Now during this time, this is called Eschar. This is your dry necrosis, whereas stage 4 was your wet necrosis or sloughing. During this time, we're focused on preventing infection, we're focused on protecting those viable edges of the scar, and really debridement. It really is a focus of scar management at this time and really counseling our patient to make sure that we can heal this scar as clean as possible. I want to end on a high note. This patient 1 year later received a hair transplant, and look how beautiful these results are. She looks absolutely incredible. That hair growth is going to be so beautiful. Give it another year and it's going to be lush and beautiful hair again. And she is so lucky, and I'm so happy for her. But this whole skin ischemic journey really taught me so much as a provider. I thought I knew how to treat a vascular occlusion, but never did I dive into the stages of skin ischemia. It's incredibly important that we understand how to treat a vascular occlusion, but also how to recognize the wound as our patient's going through it, so we have a global understanding of a true vascular occlusion. I'm so grateful for Gillian and Dr. Danny Soares for diving in deeper and helping educate us on these stages of skin ischemia. So if you loved this video, please hit that subscribe button so I can film more videos and learn as you guys learn as well. Thanks for joining.